and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health, and today we're going to take a quick look at work requirements in public benefits. We share some resources with you at the end of this presentation, but you can visit them at any time by clicking on that information button you see at the bottom of your screen. Let's take a quick trip down memory lane and look at 2015, when the state of Wisconsin implemented a change. It started as a pilot project and then it became statewide, where the requirement was that if you're an able-bodied adult, you had to work to keep your FoodShare benefits. There were some programs introduced that were some workforce training programs, and if you were participating in one of those, you could also maintain your FoodShare benefits. We have a separate video case tip that looks at the work requirements in FoodShare for able-bodied adults that you can visit. We link to that at our information button as well. Recent data has been released that tells the impact of those 2015 rule changes, including work requirements in FoodShare, and it's not good. The state of Wisconsin said, well, we've connected a lot of folks to work through this requirement. And the new data that comes out says, yes, but 64,000 people have lost their FoodShare because they were not able to find gainful employment that met the threshold that the state had imposed for work. It's a large number of people. People became ineligible for their FoodShare. Food pantries and supports in the community have noticed a surge in people seeking food support and benefit from them in place of the FoodShare benefit. And other people have indicated that while they are working and making less than $12 an hour, they technically are eligible for FoodShare benefits, as $12 an hour is simply not enough to sustain a family anyway. So they're putting in perspective what that looks like, that even if you are working, you could have low pay and still need some of the social supports that exist in the community. So it's not an either-or situation. Why are we talking about this now? The timing is critical. Work requirements are being proposed as a requirement to get BadgerCare Plus for childless adults in the state of Wisconsin. If you are not working or you do not have job training program experience in the works, and you are on BadgerCare Plus for childless adults, the proposal says that if those work requirements aren't being met, you could lose your BadgerCare Plus for childless adults after 48 months. You will then be restrictively re-enrolled from the program until you can find work, or 6 months, whichever comes first. Because this is being introduced at the state level, it has to get federal approval. Other states have included work requirements for their Medicaid programs. Indiana did it. Seema Verma, who's our new CMS administrator, came from the state of Indiana, where she helped institute work requirements in Medicaid. It was part of the condition of their Medicaid expansion program, but it still happened. Wisconsin wants to follow suit and do that in Medicaid as well. The Trump administration has suggested they will be flexible when states are asking permission to make changes to their Medicaid or BadgerCare programs in the state of Wisconsin, such as in the state of Wisconsin. So it's something that is proposed. It's not the rule yet, but we know what has happened with FoodShare, and we can see the writing on the wall for the Medicaid program as well. There is an opportunity to comment on that proposal that is going to Washington to ask for work requirements for childless adults. We have a separate video case tip on Section 1115 demonstration waivers where we tell you how to comment. You can also visit some of our sources and resources by visiting that information button and find it there as well. Thanks for joining us.